Addressing the challenge of antibiotic-resistant diseases, strategies for treatment and prevention. These challenges emerged as a global health crisis, posing a significant threat to human health and the effectiveness of modern medicine. The overuse and misuse of antibiotics have accelerated the development of antibiotic-resistant bacteria, rendering many commonly used antibiotics ineffective against infections. Antibiotic-resistant diseases, such as methicillin-resistant Staphylococcus aureus, MRSA, multi-drug-resistant tuberculosis, MDR-TB, and carbapenem-resistant Enterobacteriaceae, present formidable challenges for clinicians, healthcare systems, and public health authorities worldwide. In this video, we will explore the complex issue of antibiotic resistance, examine current strategies for treating antibiotic-resistant diseases, and discuss approaches for preventing the further spread of antibiotic resistance in healthcare settings and communities. Understanding antibiotic resistance. Antibiotic resistance occurs when bacteria evolve mechanisms to evade the effects of antibiotics, rendering them ineffective in treating bacterial infections. This evolutionary process can occur through various mechanisms, including genetic mutations, horizontal gene transfer, and selective pressure from antibiotic use. Bacteria that acquire resistance genes can survive antibiotic exposure and proliferate, leading to the emergence of resistant strains that are difficult to treat and control. The consequences of antibiotic resistance are profound, resulting in longer hospital stays, higher healthcare costs, increased morbidity and mortality, and limited treatment options for patients with antibiotic-resistant infections. Moreover, antibiotic resistance undermines the effectiveness of essential medical interventions, such as surgery, chemotherapy, and organ transplantation, as the risk of post-operative infections and complications increases when antibiotics are ineffective. Treating antibiotic-resistant diseases. Treating antibiotic-resistant diseases poses significant challenges for healthcare providers, as many of the standard antibiotics used to treat bacterial infections are no longer effective against resistant strains. In response to the growing threat of antibiotic resistance, clinicians must employ alternative treatment strategies and antimicrobial agents to combat resistant pathogens and prevent the spread of resistant infections. Antibiotic stewardship. Antibiotic stewardship programs aim to optimize antibiotic use, minimize unnecessary antibiotic prescriptions, and prevent the emergence and spread of antibiotic-resistant bacteria. These programs involve implementing evidence-based guidelines, promoting judicious antibiotic prescribing practices, conducting regular surveillance of antibiotic resistance patterns, and providing education and feedback to healthcare providers. Combination therapy. Combination therapy involves using multiple antibiotics with different mechanisms of action to target resistant bacteria and prevent the development of resistance. By attacking bacteria through multiple pathways, combination therapy can enhance the effectiveness of treatment and reduce the risk of resistance emergence. Development of new antibiotics. The development of new antibiotics is critical for combating antibiotic-resistant diseases and addressing the growing threat of multi-drug-resistant pathogens. However, the pipeline for new antibiotic discovery has dwindled in recent years, due in part to scientific, regulatory, and economic challenges. Efforts to incentivize antibiotic research and development, streamline regulatory pathways, and promote public-private partnerships are needed to spur innovation in antibiotic discovery. Alternative therapies. Alternative therapies, such as bacteriophage therapy, monoclonal antibodies, and antimicrobial peptides, offer promising avenues for treating antibiotic-resistant infections. Bacteriophages are viruses that infect and kill bacteria, offering a targeted approach to treating bacterial infections without harming beneficial bacteria. Monoclonal antibodies can neutralize bacterial toxins and enhance immune responses against resistant pathogens, while antimicrobial peptides have broad-spectrum activity against bacteria and may serve as alternatives to traditional antibiotics. Host-directed therapies. Host-directed therapies target host immune responses and cellular processes to enhance the body's ability to combat infections and reduce the severity of disease. These therapies aim to modulate inflammatory responses, enhance phagocytosis and immune cell function, and promote tissue repair and regeneration. By targeting host factors involved in infection and inflammation, host-directed therapies can complement traditional antibiotic treatment and improve patient outcomes. Preventing antibiotic-resistant infections. In addition to treating antibiotic-resistant diseases, efforts to prevent the further spread of antibiotic resistance are essential for controlling the spread of resistant pathogens and preserving the effectiveness of antibiotics for future generations. Prevention strategies focus on reducing the incidence of antibiotic-resistant infections, minimizing the transmission of resistant bacteria, and promoting prudent antibiotic use in healthcare settings and communities. Infection control measures. Infection control measures play a crucial role in preventing the transmission of antibiotic-resistant bacteria in healthcare settings. These measures include implementing hand hygiene protocols, using personal protective equipment, practicing appropriate isolation precautions, and conducting environmental cleaning and disinfection to reduce the spread of resistant pathogens. Vaccination. Vaccination is an effective strategy for preventing infectious diseases and reducing the incidence of antibiotic-resistant infections. Vaccines stimulate the immune system to produce protective antibodies against specific pathogens, thereby reducing the risk of infection and the need for antibiotic treatment. Vaccination programs targeting bacterial pathogens such as Streptococcus pneumoniae, Haemophilus influenza, and Neisseria meningitidis have contributed to declines in antibiotic-resistant infections and associated morbidity and mortality. Surveillance and monitoring. Surveillance and monitoring of antibiotic resistance patterns are essential for detecting outbreaks of resistant infections, tracking trends in resistance prevalence, and guiding antimicrobial stewardship efforts. Surveillance systems collect and analyze data on antibiotic resistance from healthcare facilities, laboratories, and public health agencies to inform clinical decision-making, guide antibiotic prescribing practices, and identify emerging threats of antibiotic resistance. Public education and awareness. Public education and awareness campaigns play a crucial role in promoting prudent antibiotic use, raising awareness about the risks of antibiotic resistance, and empowering patients to engage in informed decision-making regarding their healthcare. These campaigns provide information on the appropriate use of antibiotics, the importance of completing antibiotic courses as prescribed, and the role of patients in preventing the spread of antibiotic-resistant infections. One Health approach. The One Health approach recognizes the interconnectedness of human, animal, and environmental health and emphasizes collaboration across disciplines to address complex health challenges, such as antibiotic resistance. By adopting a One Health approach, stakeholders can work together to promote responsible antibiotic use in human and veterinary medicine, minimize antibiotic residues in the environment, and mitigate the spread of antibiotic-resistant bacteria between humans, animals, and the environment. In conclusion, antibiotic resistance poses a significant threat to global health, necessitating urgent action to address the challenge of antibiotic-resistant diseases. Treating antibiotic-resistant infections requires a multifaceted approach that includes antibiotic stewardship, combination therapy, development of new antibiotics, and alternative and host-directed therapies. Additionally, efforts to prevent the further spread of antibiotic resistance through infection control measures, vaccination, surveillance and monitoring, public education, and a One Health approach are essential for controlling the spread of resistant pathogens and preserving the effectiveness of antibiotics for future generations. By implementing comprehensive strategies to combat antibiotic resistance, healthcare systems, policymakers, and communities can work together to safeguard public health and ensure access to effective treatments for bacterial infections in the years to come. If you received value from this video, please like and subscribe to the channel.